Thank you, Tony. Thank you, Luigi, for inviting me here. And I didn't really have a good clue of what this workshop is going to cover. So at that time, when I was approached, I thought, I was asked to talk a little bit about our healthy cities in China work. So this is more or less what I prepared for you. But yesterday, it gave me a lot better idea. And this is where in Tsinghua, I've been, you will see that I've been asked for, at the beginning, I've been asking, and eventually I've been asked by the university that physical scientists can contribute to think tanks. Because in China, at Tsinghua, most of the times that social scientists and the School of Public Administration are part of their think tank reports. And I say, you need some first-hand data. And otherwise, you're just analyzing others' work. But I'm presenting something which is using others' work also. But also, I'm also showing you something that has been produced by my group. So first question, see, it didn't come out. I was going to ask, this is fine. What is the exact rate of land urbanization in China? For the past 40 years, it's a good time, 1978 to 2018. After the open door and economic reform policy being implemented. So you see that the whole Pudong has been urbanized. This is from Selena. She's not here yet. And some of the rural villages has been turned into cities. So this little animation using satellite to track China's land urbanization. Actually, it's about all over China's impervious surface. Can you imagine how fast and how big an area that has been occupied? I'll give you concrete numbers in a moment. So we just submitted this work. Although we got it done a year ago, I always delay publication. So this is for Beijing, Shanghai, and Pearl River Delta. You can see that some of the paces from those three regions. And the plain area of Beijing is over half built. And Shanghai has a 6,000 square kilometer territory. More than half of it was built. So major findings by using satellite to track the annual impervious surface area in China revealed that we were able to accurately monitor the impervious extent in China, including the rural areas. Impervious area in China increased approximately 12.3 times. This is the first time that people have a concrete number. From in 1978, only 20,000, barely more than 20,000 square kilometers in China, to more than 255,000 square kilometers in 2017. So this is bigger than the territory area of United Kingdom. It just means the whole island is fully paved. So the urban China measured almost 180,000 square kilometers. These are all only impervious area. So if you add the water, the park and the green areas inside the city, you can imagine how big actually China's urban areas are. So I would bet that more than 3% of China's territory has been converted into human settlement. And if you think about that, more than 70% or 80% of China's land are not so useful. They are in the arid or semi-arid area. Only the plain area occupied between 15 to 20% of China. This is a huge amount of pavement in China. So agricultural area, more than 140,000 square kilometers has been converted to urban. Not to include, you can imagine that from 20,000 to 250,000, that more than 220,000 square kilometers has been added. They are mostly coming from rural agricultural land. So some people are curious about, which province, and, you could basically do the statistics at various kind of levels. And as a provincial scale, the big bar is my hometown province, on the top. You see the blue bar that became so high is Shandong province. The second highest is Jiangsu province. Jiangsu province is actually only barely about 100,000 square kilometers. It has more than 16,000 square kilometers paved. Then it comes down to Hebei and Guangdong. See, because Guangdong has a lot of terrain issues, you can't really build because the flat areas in the Pearl River Delta is not so big, so they are restricted, I think, by land. Then you also have, on the top it's urban, and at the bottom it's the urban and rural paved surface add together. So these are just some numbers I want to show you. And on the other hand, although we didn't really touch upon, I think most of you are aware how important it is for the wetland areas. I pull out just for wetland area. It happened that in 1978, we made a map for that particular year. Then we used the 2017 impervious surface area draped on top of the 1978 wetland map. You could find that more than almost 5,000 square kilometers wetland has been paved, and not to mention other conversion, just paved surface. So a lot of it is coming from inland marshes and also river wetland. How does it compare to Japan? Now, we often say that, China per capita area based build construction or, living space is not as big as Japan is. Actually, the answer is China far exceeded Japan already, which is something that when I hear this number, I have this intuition. When I saw the result, I feel so sad about it. Who's the example in the world we should follow, we should learn the most? I'm sure not United States, but China learned from United States. So this is in year of 1985, the area of impervious area in China compared to Japan. Actually, even though China has almost 10 times the population, the built-up area is smaller than Japan in 1985. But by year 2017, Japan, rural and urban, for the whole 330 1,000 square kilometers of territory only built up for less than, just about barely, 14,000 square kilometers. We use the same method. We could map the whole world. So you can see that China has more than 10 times Japan's development. Definitely, almost 20 times. So on a per capita basis, China exceeded Japan on paved surface area for more than 60%. Can you imagine? Now, we could actually do a per capita area calculation and draw two curves together. You will be able to find which exactly year that China exceeded Japan. I didn't really do this actual calculation, but this just shows how fast, how much steel and cement or concrete has been put in China's land. Is that good or bad? So those are the questions with this particular data set we'd like to investigate. So overall, we could also take a look at the land development comparison with some of the American cities. China reached more than half of urban population in 2011. And the United States reached that in 1920. So in that regard, the urbanization rate, that's population urbanization. Actually, the 51% in China was a faked number because, some of the rural migrants are included in the urban calculation. By the time when we have 51%, the actual hukou-based or what is called, people live longer than 6 months in the city or whatever. There are all sorts of numbers. They're not nearly 50%. So I made a statement that China's urbanization is 100 years behind the United States. Look at New York. Between 1960 to 1985, the population only grew by 8%, but the land urbanization or expansion grew by 65% more. Similarly in Chicago. But some cities are shrinking in population, but they're expanding in area. In the United States, Cleveland is an example. In China, many of the resource-based cities are also like so. So I will show you that some of the cities in China, many of them, are having a shrinking population. They're not really expanding. They're going against the central government's policy. So in terms of speed, in barely 20 years of time, China's urbanization expanded 250%. But you saw earlier, in 40 years' time, land expansion is 30%, right? 12.3 times of 1978 impervious area. So adding up with other crises, you all know, waste, congestion, pollution, all sorts of other issues, that in 2003, we began to call China's urban planning is a total failure. Has that been changed? My answer is no. China's urban planning is a total failure. So that's the first part of my presentation. It hasn't been published, the result, just to show you that some of the result. And this is something that you already have been given the reading. This is Richard Houghton, the chief editor of Lancet, was so kind, gave us a suggestion saying that in order to promote Tsinghua, this is the first time that we committed a report led by Chinese scholars. Let's put it Tsinghua Lancet Commission report. I find it's a big mistake. Tsinghua is not so famous. If you put it there, people will say, oh, Tsinghua? Forget it. I'm not going to read it. So, the term healthy cities in China is a great term, but we added something like Tsinghua Lancet Commission report on healthy cities in China, unlocking the power. Some people didn't read it. They feel that's a report, right? That's something that's an activity. So in my career, I learned so much that improperly naming an article brings so much harm to you than good. So anyway, it's a mistake, but it's a mistake for the record of its history. So the report has been published in May, although the online report is published on April the 18th. So we did a launch in Beijing. And in order to form this report, you can see how many authors are involved. Basically, the whole room of this could be working together for another Lancet Commission report. You've been competing. You've been competed by recruiters. And we're here to look for colleagues to work with us. I think Tony is being charged for something I'm not supposed to announce for him. But I'm asked by Lancet to do another report. The title is Eco-Civilization and Health. So this topic is super for us. So if you have good skills to scan, you could scan this. Obviously, you don't need to because you were given the material. So when I go to a talk, I often have to come up with this. People will scan and then get actually related reports, not just, the literature. So thank you. Some people have the tools, magic tools, to do this. So then, with my updated information, this is obsolete. In the report, you see the total population, urban population, and total build-up area. So I think this is way too modest. According to the governmental report, in the 1970s to 2015, China's build-up area in urban is barely more than 50,000 square kilometers. Right? I told you it's more than 170,000 square kilometers. Something around that. So it's way different. Why? Is the government, are we being so unrealistically wrong? Let me tell you that the Chinese government officers don't believe their numbers, not to mention the general public. So you go to the Ministry of Housing and Urban-Rural Construction, their leaders do not want to use this, basically provincial, municipal supplied data, and they add it up together to get these kind of numbers in the statistical year report for urban or the country statistics. So anyway, this was what appeared in the report. They are all secondhand, as I told you. So I didn't really produce these numbers. They are all published. They are actually provided by the National Bureau of Statistics. So on urban life expectancy, compared with the rural area, the urban life expectancy is better, barely 7 years longer for males, and 6.6 years longer for females. That means females in the rural area are having a better condition, slightly better than male, right? You know that females live much longer than male in general anyway. So you can, these lines shows that in the 1990s, the proportion of urban population versus life expectancy, as the years, when you move to 2015, the proportion of urban population and life expectancy difference increased. So the slope actually went up. That means in the urban area that the difference is between the rural and the urban is actually becoming bigger. So what are the challenges in China nowadays? Later, I will show you in another report some of the real actual categorized disease burdens in China. But now, it's safe to say that non-communicable disease burden is the biggest in China, almost 80%. Before, in the 50s, 60s, infectious disease took the leading role. So now emerging infectious disease is still a problem. Injuries and mental health challenges is big. Later I will show you in an example. And aging population is clearly a problem. One question I have for you is how to solve China's aging population problem. I have some thought. The Chinese government doesn't agree with me, but I believe that's the right direction. So I will keep argue for that. But I think that for you, as an outsider, from yesterday I know how great this group is, that you will come up with something really good as some suggestions for a solution. Price, economy is always a problem, the rising health expenditure, and of course, health inequity is an issue between the poor and rich, between different locations in the country. So just an example that to demonstrate the non-communicable diseases using cancer as an example. Compared to 1990 with 2013, that's a cancer rate in China in almost every aspect. There are more than 200 cancer types. So it's not one disease. And they're mostly increasing in China. So for the non-communicable diseases, risk factors ranked high include air pollution, water pollution, low level of physical activity, unbalanced diet, tobacco and harmful use of alcohol, extreme weather events, and metabolic risk factors. I'm sorry I made imbalanced figures. These are helpful for my Chinese colleagues, but the titles are all on the top left corner, but you may not be able to read. Fortunately, you have the report. So this resolution is a little low here. Basically, for some diseases, such as HIV, AIDS, and also sexually transmitted diseases, China has been, the situation is, infectious disease is increasing, but overall it is decreasing. Dengue is a different, emerging infectious disease from southern China, thanks to, some people say, it's climate change, global warming. Mosquitoes are happier, to live in China. But it's also partly because I think, more frequent traveling, a bigger volume of people. China claims some biggest airport reception, for people. Beijing is number 2. Canton is one of the top 20 or 10 airports, I think the third, top 10 in the world, busiest airport. So that may be contributing to the problem. Injuries and mental health are increasing. Later, I will show you in a different figure, which shows mental health is a serious issue, even though it's not causing so much death, but it definitely hurt the productivity of the population. And a lot of them are underreported. So later I will show you in more detailed work why injuries are important for us to consider. Aging and the health expenditure, earlier we have shown. So on the left is basically the health expenditure is sky rising. So, and aging, you all know, I don't really need to provide more details about this particular situation. So there were arguments that China should allow people to have as many kids as they can. You know, whether or not that's a possible solution or feasible solution, or the policy that can allow that, I don't know. I don't like that suggestion. So you can see that in the health expenditure side, in the 2000, around 2000, or before 2000, you know, in the late 1990s, Chinese citizens are suffering so much they have to pay so much by their own, you know, under the reform of medical care, that they pay a huge portion of that. So in recent years, so continuing, still ongoing medical reform, insurance reform, reorganizing, completing the coverage, all sorts of effort are being pushed. And the governmental and societal contribution are increasing, which is a good news. And then I mentioned, you know, the inequity issue. So it's reflected in space disparity, or we call geographical disparity, income level or wealth disparity, and also it's reflected by some of the health insurance schemes that are being covering for different people for different percentages of reimbursement. So those are the issues that we identified through literature search. And we also try to see what are the major actions. You know, the Chinese people take good care of their own health if they are able to, you know, provided that they have sufficient amount of money and also good access to medical services, they will do that. Although some unintended health issues due to education and all sorts of other things, habit and also behavioral issues exist. But what we are summarizing here are mostly from the government. So the governmental actions include controlling the environmental pollution, particularly in recent years. We begin to see the effect and improve the livability of cities. You know, many cities put a lot of infrastructure, money, and enhance disease prevention and control. China's CDC is good after SARS. And reform the health sector is still a continuing effort. And they are building hygienic cities for almost 30 years, starting from 1989. And now After 1994, they began to do pilot tests for healthy cities. So that started in 1994. So some examples, I'm not going to elaborate on the activities that has been made by the government on policies that has been implemented are listed here. So this is actually in the report, so I'm not going to give you more detail. So on the right is a panel of major actions taken by 36 cities in China. We did a survey asking them, what kind of effort did they make to build healthy cities. So that's something new, based on our own survey. So, but, it's broken into the city governance, healthy environment, healthy society, the health service, and healthy people, and health culture. So those are the kind of efforts that has been reported by the different cities that has been summarized. On the left, this is a nice map showing that some green dot. If you don't read the green, you would feel great, Usually you have a good feeling about green. But those green means the cities are reducing in population size. Not the actual physical size, but in population. See how many cities in China are actually shrinking in population. So there's a huge population aggregation in some of the cities because population is limited. So among those green dots, there are many of them. They claim that they want to build international cities. They want to be the biggest city in the world among the top cities in the world. They don't even build any judgment on that they are not able to allure any population to add onto their population size, existing population size. So in the middle, I have the hygienic city movement. I mentioned that more than 270 cities in China has been rigorously evaluated for more or less environmental conditions and food and sanitary conditions. More than 100 factors being examined. They qualify to be entitled a hygienic city. You go to Shanxi province, which is a major resource coal mining province. You go to any city, most of the big cities say, we don't want to become a hygienic city. It's too hard. Because, their environmental condition and also their habit, behavioral issues in their population are harder to meet the requirement for a hygienic city. Regardless, many cities in the East Coast are actually faring in this aspect. So as I mentioned, healthy cities are still in the pilot stage. Now, under the National Health Commission, there are only 38 cities under the pilot. They don't allow any city to become a pilot city if they are not a hygienic city. Hygienic city requires every 3 years, they send experts to check up the city without notifying the local government. If they fail, they will be notified that it's a big shame to the city governors. I heard a story that during the time when the central government is sending those experts to a particular city, China's, the city public safety bureau is able to determine who might be the national experts coming to their city. So nothing is in secret. So that's how China's public security is good about. So we also have identified some gaps in this report. Those include urban health cannot be dealt solely by the health agencies. It's way too complex. But the actions from different departments of a city, sometimes they don't really join force. Just like yesterday, Professor Li Mu from this university came to say that some good intention may end up with bad consequence. So you really need a coordinated and systems approach to deal with urban health issues. Also, the bottom-up efforts have not been called up to join force to produce better effect. Although the top-down, as I mentioned, is already broken in pieces and are not really unifying their effect. And some of the departments never share data. They don't work with each other, so they don't cooperate. Everybody wants to have their big findings for President Xi. Nobody wants to have their big findings to share with their neighborhood department. And again, for the health equity issues, there's a lot that need to be done. So in this report, we recommended that healthy cities should be the way for local governance to improve basically health. And you need a systems approach for managing urban health that requires the whole government and whole society to participate. And they need to address both the environmental and social determinants of urban health. And in China, China's cities are much more powerful financially and also politically than most of the Western cities. So they actually have a lot more to do to help change the situation and support healthy cities development. I didn't even define what a healthy city is. Here's definition by WHO. Healthy cities are ones that are continuously developing those public policies and creating those physical and social environments which enable its people to mutually support each other in carrying out all functions of life and achieving their full potential. So that's what healthy cities is about. In China, it's the best time or, suitable time to develop healthy cities. You may think that I gave you a report that China has been covering such a huge amount of land. There's no room to improve. But it's time to improve interior, right? You criticized, earlier, and in your report you cover topics about what the, junk construction in Wenchuan, what is called tofu buildings. They don't really support, they don't meet the design standard. And just a few days ago, one of my colleagues' sister died from attending a celebration of her neighbor's completion of a housing in Fujian province. 8 people died under the roof, because the roof collapsed, of a new building. So that's how, indeed, in China, injuries, that's why I'm saying it's a big issue in China, not just on the road transport. So anyway, you have a lot. China is still continuing to urbanize, even though the big cities may slow down the pace in expanding the land, but the second tier, third tier, and some of the smaller cities are going to take up the speed. So there's still room for us to actually use healthy city as a goal to, or as a measure to help better planning of the city. So we recommended some actions. One is to revise the guiding principles and reform the urban planning system. We suggested that urban planning should be the entering point for healthy city development. Later, I will show you that this recommendation is indeed taking effect. We also suggested to increase participation, particularly for the communities, public participation, and increasing the community capacity, and engage the private sector. Why for the private sector? The private sector now recruit 80% of the employment in the cities. So even through their own business education, that it could make a huge impact. Not to mention, a lot of them now are moving into the health sector for services. There's a huge market for making innovations. And they also produce 60% of the city GDP. Okay, so they are a bigger component of the urban economy. Now, there are ways that even just for healthy construction, in the office, healthy office could make a big difference, could influence their employees to think at home to build a better environment for themselves, for living, change their habit. So Delos was an example that they are gaining a huge momentum in China to promote a healthy building standard called WELL. So the third recommendation is to promote intersectoral collaboration. I already mentioned that. Will this be possible? Recently, I wrote a note to the Chinese government. I said, if you don't make China to share the data, China will lag behind the world again. So if they don't solve this problem, nobody need to be worrying about the rise about China. They will make the disservice themselves. And the fourth recommendation is to set local goals and assess progress regularly. So what we promised, we got the permission from Lancet, is to do a progress report next year. So then gradually on Lancet, we'll continue to publish this subject about China's healthy cities effort. So we are developing indicators for this. Time-wise, I know I observed yesterday we were going to stop around, I have about 10 minutes. So this is barely enough for me to share with you my stories. So we're going to do that. This is something that we are also requiring more people to help, from different aspects. And the last one is something for the government and for ourselves, give us more money, we do a good job, So every report has this, so there's nothing really special, right? So China, although there's some different voices or opinion about China's Belt and Road effort, but that's something that people could take advantage of, do to enhance international collaboration. There are a lot to learn from other countries. And some of the China's, advantages should be taken rather than rejected. As long as you use it in the right way, they're still helpful, right? So basically, we are encouraging the situation, and we are confident that China can face the health challenges and lead the world in securing sustainable health for all. This is a report, more or less. So after the publication of the report, we made the launch, and also I went to different places just like this to give talks. And Selena and Tony and many of my colleagues are helping spreading the word. So interestingly, some of the urban planning and School of Architecture are taking action. Before that, I invite the president of the Urban Planning Association of China to join our launch event. He would say, health? I don't even have a clue what you guys have anything to do with urban planning. But after he attended it, he said, Professor Gong, it's a good idea. It's for President Xi. So that indeed causing a change. So there are curriculum change and institutional change. For example, Tsinghua University, the Department of Urban Planning said we need to make a new growing point, do healthy cities. So there are actions. And in November, I was invited to a talk, planetary talk, facing more than 10,000 people, organized by the annual meeting of China's Association of Urban Planning. So those are all the things that you can see. Of course, I was also invited to the Interaction Council. Those are the old state leaders, retired state leaders. They ask us, actually, Tony, it's recommended by you. Healthy, planetary health. They wanted me to talk about planetary health. Of course, I took the opportunity to give them a lesson on healthy cities in China. They enjoyed it. So they put my report on their webpage. After my talk, I was asked, whether or not they could put it on the Interaction Council's webpage. I'm a geographer. I'm not an urban planner. I don't belong to the School of Architecture at Tsinghua. But when the Ministry of Housing and Urban-Rural Development, or Construction, was asking Tsinghua to build the Tsinghua Urban Institute, this is the name I gave, that the university and the ministry point their finger to me. They don't want the traditional urban planners to lead the Urban Institute. They want to have an urban science or urban social science. They want to systematically look into the future of how the cities look like. They don't want to have the designers to do this. So those are the various kind of meetings that I went to give talks. And we even, to my surprise, cities are willing to pay so much for such a short period of time for your thought on their healthy city development. 2 months, a few million Chinese yuan given to you to produce a report for them. No wonder, those think tanks are really worthwhile to do. So healthy cities in China requires a multi-scale approach. You need to combine the macroscope and microscope. And you need to look at the details, and you need to look at the change. You need a systems approach. You need to combine the top-down and bottom-up approaches. The shortcoming of China's development actually are the lack of a systematic design. So during the past 40 years, a consequence of copying, in Chinese it's very beautifully spoken. And you could say, 知其然,不知其所以然. China's urban planning, everybody knows that it's in UK, it's created for dealing with the public health problems in London or in the city, urban areas for the working class. Every urban planners know this, but they all forgot when they do the practice. So they emphasize on the appearance, but ignore the actual function. They emphasize the local effects, ignore the entirety. They emphasize on present, but ignore the long-term effects. Those leading to the poor satisfaction of the residents. And as a tradition, of the Chinese, they emphasize on the hardware and buildings. They ignore, the real soft environment. And there's no penalization. Big ghost city has been wasting so much resources. The mayors are still getting promoted. So they don't get penalized. So the thing we want to do to progress, to rank healthy city development in China is trying to put up some pressure to the central government or make something visible for the central government that some cities are not doing the adequate job. So we now call for human-centered planning and development of healthy cities. Let me give you an example on Tsinghua campus. Why copying 知其然,不知其所以然, getting some inexperienced people to do things. Look at this. This is outside my building. You go out, you run into the barrier, right? So I took the picture. Look at this. I show you this picture, you all know the answer, right? Look at that. No light, okay? Somebody is biking there, they're going to suffer. Look at that, a busy intersection. So I made an email to the president of the university. I said, you have some, unexperienced designer to design this campus. It's a shame of the campus, shame of the university. I didn't tell him the solution. So the second day I walk along the road, I saw some trucks. Some workers are starting to do things at exactly the location I pictured for. So 1 week later, that's the result. They can do something. But other places, I didn't take the picture. I didn't send it to the university. They didn't care. Nobody cares. So recently I called the student in my class. I said, 走遍校园每一米，看看合理不合理. That's a beautiful Chinese, okay? It just means that let's walk around the campus and see whether or not it's reasonable. Something like that you can translate for every corner. This is Tsinghua, one of the top universities in China. Can you imagine? This is Beijing. I walk around the city. You find there's no pedestrian road. Okay? Can you believe that? And they gave way to cars. Bikes are suffering also. Can you believe it? Lots of places are having this kind of situation on both sides of the road. Okay? So that's why I say design for a healthy city. I could easily stop here. Give me 3 more minutes. There's some good stuff. Look at the red ones. The horizontal bar is age groups, from juveniles to elderly. In the middle, The red one are mental health problems in China. In percentage. This is a published report in 2013 on the major health burdens in Lancet. And comparing 1990 to 2010, some of the disease patterns has changed, the burdens has changed. But look at when you sum up, the mental issues is huge. And then also look at the road injury on this column. On this column. It's a number 4 killer. Road injury alone. So there are other injuries. So to build the city, we need to do something. So I misplaced this one. This one is basically saying all the efforts of green, sustainable, low carbon, ecology, civilized cities should be serving the goal of healthy cities. I'm dealing with healthy cities. I have to say healthy city is the ultimate goal, for all the other efforts. So I summarized here, all the other efforts are not really touching upon serving the ultimate purpose of human living in the city. So healthy cities should be able to integrate all the efforts for that. So that's basically a conclusion. The last part is healthy campus is a small effort, part of healthy cities development. At Tsinghua, we try to do things to find out, where are people, what's the forms of traveling for the campus students and campus community. So this is a map I don't really have time to fully explain, basically to show that you can quantify, you can do survey to get some data to support a better planning or design of the campus. Design for healthy cities or healthy campus should consider both space and time. Even though you think that people might be at certain place, they may not be there. You really need to have the data to support you for that. And at the right time. During the evenings, where are the people? You need to put more light, right? To make their travel safer. Also, location. Based, a hospital, campus hospital, how far is it? From one particular facility, how far are you able to go? From a densely populated location, how quickly can you get them out of that particular space? In China, people like to hold big meetings on top of the building. But they couldn't really get into it. It takes them hours to get into the building to meet. And when they go out, their elevators are so few that they can't really get out. Most of the people doesn't want to use the stairs. And even they use stairs, they find the stairs are blocked. Some doors are locked. So that's the Chinese habit. That's our behavior. Something are wrong. Okay, food, living, walking, whether or not we have a lot of questions and doing survey and doing quantification of nutritious level of all this food. So we are doing these things. Don't blame. Air pollution, indeed, the compacted cities are actually having worse air, okay? So we're doing all these kind of measurements in cities, and I don't have the time to complete. And to yesterday's talk on planetary health, I want to add a few dimensions. Yesterday we were worrying about, is it worthwhile or is it feasible to do planetary health? My answer is yes. It is possible to do it because we are a highly connected universe now, planet. So for example, we need to break the bottleneck in data sharing, starting from the big corporation, Google is a good place to start with. Baidu has a lot of useful data. Now they are willing to share with us. So this is a good step forward. This is for, travel and the hotspot of people, where people are distributed at every individual minute. They have the data. And we could use satellite, like what Tony has explained, that my job is mapping the world. So I have a slogan, mapping the world in a day. With Google, you are able to do it. So you can do it frequently. Why do we need to do it frequently? This shows you. Basically, we are entering into an integration era where ground, air, and space-based sensors can be used collectively to monitor Mother Earth. In combination with bioinformatics analysis, the integrated observation of Earth helps us to understand the mechanism of disease spread. These birds carry diseases. These are the right time, when the background Earth is basically the time they land, how the Earth look like. Lots of snows are there, right? So we need to map Mother Earth so frequent so that we know exactly where the bird is looking around. Because we don't really have the cameras for all the birds. So you have to use this background information to support our studies. I'm sure you will get inspiration from this. And we also need to have predictive tools. This is, we are developing a community integrated Earth system model. We need to have a futuristic perspective of Mother Earth. We build this model including all sorts of components. You can see we even have the red disease transmission model. So we're building that. We haven't really coupled that fully together yet. Not to mention climate. It's only an elemental part in this effort in our group. So to summarize, we must adopt a new research paradigm. In planetary health, healthy China, healthy nations, healthy cities, healthy communities, healthy families, we need to observe this. The lesson learned for me is planning must be based on data and evidence, not by the mayor said, that mountain should be chopped off, then the whole working forces are going to do that. No, that's a big no. And research with changes, globalization, and people, and population dynamics in mind. Anything local needs to be put under a global context for research. Sydney doesn't have the problem for its own. It's a problem for the whole world. People come and go. It's fully connected with the rest of the world. Remaining challenges are we're not certain about those joint effects of those interactions between environmental change and also human health. Understanding planetary health requires better data, more quantitative tools, and stronger computing power. Of course, better analysis, by people like you. And the last point I really hope that we will be able to share is the lessons you learn from one place should be transferable and shareable to avoid to be repeated in another place, particularly in the developing countries. So with that, my research are mostly supported by private foundations. The government doesn't really contribute much. And thanks for their generous donations. I'm sorry I used up slightly more time because at the beginning, it's already 9:10. So thank you very much.